Obstetrics relates to the process of pregnancy and birth. In obstetrical procedures, the team is faced with the challenge of caring for the mother and the child. When a woman suspects she is pregnant, she will get a pregnancy test. This test can be a urine test or a blood test that detects the hormone levels of human chorionic gonadotropin, HCG. An ultrasound scan will usually be done later in the pregnancy. This test is useful to assess fetal age and identification of some types of defects. It is also used to check fetal growth, amniotic fluid volume, fetal position, and location of the placenta. Here is a list of other tests that can be done during pregnancy because the results can impact the fetus and certain maternal conditions can lead to birth defects. Pregnancy has two phases. The embryonic phase starts when the ovum is fertilized by the sperm, which normally occurs in the fallopian tube. The embryo moves into the uterus and implants in the endometrium about 10 days after fertilization. The fetal phase begins at week 8 and lasts until birth. 3 complications that can occur during pregnancy are abortion, incompetent cervix, and ectopic pregnancy. An abortion is a spontaneous or induced termination of pregnancy before the fetus has developed to the stage of viability. There are 4 types of abortion. The missed abortion is a condition in which the products of conception or fetus is non-living and is retained in the uterus. An incomplete abortion is one in which only part of the products of conception have aborted. An imminent abortion is when the patient is about to abort. It may be indicated by heavy vaginal bleeding. The last type of abortion is the therapeutic or voluntary abortion. That is what most people think of when they hear the word abortion, and a procedure that the mother voluntarily agrees to have. An incompetent cervix is a condition in which the cervix cannot bear the weight of the fetus. The growing weight and pressure of the fetus can lead to a spontaneous abortion. An ectopic pregnancy was discussed in the GYN lecture. The treatment for an abortion is a D&C with or without suction, and the treatment for an ectopic pregnancy is a laparoscopy or a laparotomy, both discussed in the GYN lectures. The treatment for an incompetent cervix is a Chirurg-Carr procedure or a cerclage. This procedure uses a purse string suture to maintain closure of the cervix to prevent premature delivery. The suture is removed before delivery. The placenta is a thick organ that adheres to the uterus on the maternal side. The umbilical cord, which attaches to the placenta, contains the umbilical artery and vein and communicates directly with fetal circulation. The placenta plays a major role in the baby's health by allowing essential nutrients to pass from the mother's blood to the fetus. Failure of the placenta to function for any reason can be life-threatening to the baby. There are 2 complications that can happen with the placenta. Placenta abruption is the premature separation of the placenta from the uterine wall after 20 weeks gestation and before the fetus is delivered. This complication can be caused by abdominal trauma, abnormalities in the uterus, short umbilical cord, and hypertension. It can be partial or complete. The baby has a good chance of survival if half or more of the placenta stays attached to the uterus until delivery. Fetal demise can result from complete abruption. Placenta previa is when the placenta implants completely or partially over the cervical os. The placenta will bleed as it separates from the cervix during labor. Sudden hemorrhage is life-threatening to both mother and baby, and an immediate C-section is needed to prevent fetal and maternal deaths. This hemorrhage can be prevented if the C-section is performed before labor. Pregnancy-induced hypertension, also called PIH, is another potential complication of pregnancy. It is high blood pressure that happens only during pregnancy after 20 weeks of gestation. It can lead to problems with the kidneys, proteinuria, problems with the liver, elevated liver enzymes, problems with the blood, low platelets, maternal seizures called eclampsia. This disease process is also known as toxemia or preeclampsia. It is usually in the first pregnancy and the cause is unknown. Hypertension can also constrict the blood flow to the placenta and the baby. There are 3 stages of labor. In stage 1, the cervix thins. This is called effacement, and the cervix dilates and begins to open. 10 centimeters is considered fully dilated. Stage 2 is from the point that the cervix is fully dilated until the birth of the baby. Stage 3 is after the birth of the baby when the placenta is delivered. This is usually within 20 minutes of birth. The delivery of the placenta might be assisted with gentle cord traction, the administration of uterotrophic drugs, a maternal squatting position, or breastfeeding. Oxytocin, pitocin, and methergin are uterotrophic drugs and cause the uterus to contract.
In the weeks before birth, your body slows down production of the hormone progesterone while increasing production of other hormones, including prostaglandins, which soften the cervix, and oxytocin, which triggers the uterine muscles to contract. True labor contractions are rhythmic and painful and grow consistently stronger. As the long vertical muscle bands of the uterus tighten, they pull the cervix open. The strong muscles at the top of the uterus push down and release, guiding your baby toward the cervix. The mucus plug, a collection of thickened cervical mucus that sealed your cervix shut for 9 months, may be expelled days before or in the midst of labor. When the amniotic sac ruptures, your water has broken. It can feel like a trickle or a gush of fluid. Your cervix will begin opening and thinning, known as dilation and effacement. Once you reach about 4 centimeters, your body will move into active labor. In active labor, contractions become stronger and closer together. At 8 centimeters, you enter what many consider the most painful part of labor, transition. By 10 centimeters, you're fully dilated and may feel the urge to push. This is your signal that the second stage of labor has begun. Your baby will move down with each contraction. The 3 separate soft bones of his head will temporarily overlap so he can pass through the snug birth canal. Your baby's scalp will come into view. When the widest part of his head is visible, your baby is crowning. With several more pushes, your baby's face, shoulders, and body will emerge. In the third and final stage of labor, your placenta detaches and is expelled. With your baby's first breath, the incredible journey of birth is complete.
An epidural is a common form of anesthesia that is used during labor. It can be placed when the cervix has dilated to 4 to 5 centimeters.